Councillor McNess also mentioned, it's absolutely vital that we foster better links with the voluntary sector to ensure that no groups are falling through the gaps, to make the best use of resources in a very difficult economic environment, and make sure that we're signposting people to available support. So in your groups, you've been considering the 5 strategic themes of the Joint Health and Wellbeing Strategy and working through a SWOT analysis to look at the existing strengths, weaknesses, what opportunities are there and what threats are there to making this work. So what I'm going to do now is to feed back the top 2 strengths and then the top 1 opportunity that was identified by each group. Now obviously, I've been round to most of the tables and there were some really rich discussions and a huge amount of information that will have come out of your discussions. Now that has all been captured by your facilitators and that will all be collated and analysed and fed back in detail for consideration by the board. So although what I'm giving you now is almost a snapshot, we are not going to miss anything. And I think it's also important to say that if you feel that you haven't had the opportunity to feed in an important piece of information, we will identify, or perhaps work with Jane to identify the best route through which you can feed that back, and that will also be taken into consideration. So each table was discussing a different theme. I'm just going to work through the themes now, one by one. Theme 1, give every child a good start. Some key strengths that were identified were sure start, voluntary sector in general, expertise amongst the voluntary sector around social care and valuing true partnerships, the fact that the voluntary sector has a detailed knowledge of what works for communities and how that knowledge can be used to improve services, and then opportunities for theme 1, the possibility of Medway Voluntary Action disseminating information about available groups and activities. And in fact, this opportunity did come up at a number of tables. Developing shared goals with partners that keep people at the centre was another key opportunity that was identified for theme 1. So moving on to theme 2, which focuses on older people. Current strengths. One identified strength was the integrated discharge team, which is based at Medway Foundation Trust, which ensures that older people, when they're discharged, are discharged with the relevant social care input in place. Another strength was the Medway Older People's Partnership, which is really the representation of the voice of the older people, the older population in Medway, to health and social care services. A key opportunity for theme 2, possibly having some sort of welcome pack on entry into supported accommodation, which signposts people into volunteering opportunities. So that's actually encouraging older people to take up volunteering opportunities. Theme 3, preventing early death. Some key strengths that came out. One was the existing faith and support network in terms of spreading health improvement messages. And an opportunity that came directly from that was that there should be a greater emphasis and promotion of faith and support networks, which would then help even more to spread those health improvement messages. Another strength for theme 3, the voluntary sector has trust, respect and credibility within the community already. And an opportunity was the potential to work with the university, not just to explore research opportunities, but also to attract people into volunteering. For theme 4, which is around improving physical and mental health and wellbeing, key strengths, one related to the creative arts and opportunities for collaborations between arts and health. And I think there's some work underway currently to map out the work being undertaken through the creative arts to improve health and wellbeing. A second strength is the existing support for homeless people, emotional support and signposting through the voluntary sector. And an opportunity, two here. One, to encourage service users to become volunteers. And secondly, the promotion of services on big screens, such as this screen that's just gone up at the bus station. And then finally, theme 5, which focuses on reducing health inequalities. Two key strengths that were identified. One is that the voluntary sector currently has a range of balanced skills and can relate to parts of the population that others can't. Second strength, better connection to the outside world, for example, probation services. And an opportunity to create an up-to-date directory of services. So the directory of services and the signposting theme came up on quite a few tables. So I'd just like to thank you very, very much for your input. Some really important information has come out which will be used to inform the way in which we take our strategy forward. Thank you very much.